I'm Grant Garcia. I'm one of the sports and shoulder surgeons here. I specialize in a number of different things, anywhere from elbow surgeries, so baseball players, thrower injuries, to arthroscopies. I do a lot of minimally invasive surgeries of the knee, and then if needed, open procedures such as cartilage and meniscus transplants and preservation techniques, as well as realignment procedures. And then of the shoulder, I do anything from arthroscopic procedures to more complex arthroscopic procedures to more open procedures for instability, and in addition to shoulder arthritis, so shoulder replacements. So I went to my undergraduate at Brown University in Providence, Rhode Island. There I majored in economics and biology. And then from there I went to Penn Medical School in Philadelphia, and there is my medical training. And then I was fortunate enough to get into hospitals for special surgery. And this is a orthopedic specialist hospital, the largest actually in the world, in New York City in the Upper East Side. And there I was fortunate enough to get some pretty impressive training from different specialists. And we actually were able to take care of about 8 professional sports teams. And then finally, I went to fellowship at Rush University, a medical center in Chicago. And there I was able to train under Dr. Anthony Romeo and Brian Cole. And that's really where I got the final, my final desire to continue to do the elbow, shoulder, and knee that we have talked about previously. My subspecialty is sports medicine, and I try to take that even further where my subspecialty is, knees, shoulders, and elbow injuries. And many times, my treatments are non-operative versus operative treatments. I have a holistic approach. So, I'm very versed in different physical therapy regimens. I know a lot of different physical therapists, and my goal with patients coming in is sometimes just to refer them to the right therapist. And I can do that at a high level because I know a lot of therapists that deal with athletes, and from anywhere from the professional level to the recreational level. Then take it one step further. I have some background training in biologics. And so as a result, I'm sort of fellowship trained in biologic therapy. So I can still offer non-operative treatments to my patients with, let's say, cartilage injuries or arthritis or other small tears that may be beneficial for this type of thing. And then if those things end up needing something surgical, I have a number of different specialties that I focus on. One of the number one things I focus on is minimally invasive surgeries. I do a lot of minimally invasive surgeries of the knee, but also very complex. So anywhere from ACLs to other collateral ligament injuries to minor cartilage procedures in terms of the arthroscopic portion. For open portion, I do a lot of different procedures such as meniscus and cartilage transplants and a lot of ligament reconstructions, things that not as many surgeons specialize in, but I have the skill set and the training that I want to do that. With regards to the elbow, this is a less commonly specialized thing for sports medicine surgeons. And you may see some of my videos with Dr. Weil and our combination surgeries, but I take care of a lot of baseball players. And so I'm able to take my skill set, which is much more stringent in that area of the elbow, and do ligament reconstructions to help people get back to either with elbow dislocations or for throwers to do Tommy John repairs or reconstructions, or with patients who have had loose pieces of cartilage, I can do minimally invasive elbow arthroscopy. And then for the shoulder, I have a very large gamut of shoulder procedures that I perform, anywhere from the younger patient with the shoulder instability to that sort of mid-level patient that's still recreational with a rotator cuff injury, to more complex things such as people that have no more rotator cuff left but are not a candidate for a shoulder replacement. And so there's other procedures that I can do. And finally, I do a lot of shoulder replacements as well. And so I like to have that full gamut of the shoulder. So those are the main things that I specialize in. Well, orthopedics was sort of I sort of came about when I was in high school. I knew I wanted to be a doctor, tried shadowing a few different types of specialists, and ended up that I connected the best with the orthopedic surgeons. And at that time I said, hey, listen, I think I want to do orthopedic surgery, but I'm not really sure what sort of subspecialty I want to do. Going through medical school, continued to be shadowing different doctors, and I said, this is what I want. And it wasn't obviously until the end of medical school they made a decision to do orthopedics, but what drew me really to it was that I could almost instantaneously help patients, and I could have that, absolute gratification of really being able to help people, getting people back to the things that they love to do, which I was able to relate to quite well as being a previous athlete and understanding what it's like to get injured and then to try to recover back to those levels of activities. And now even being a recreational athlete, I know what it's like when the patients say, all I want to do is this sport so I can get back to these things I do and I love. A lot of things that I do are not so patients just can walk again. Most of the time, that's not the major issue, at least in my office. In my office is people that say, I can't play baseball, I can't rock climb, I can't boulder. And for me, it's like I can offer this option to make them better. And so a lot of the things I do are to get people back to the things that they love and what make them happy. But I think the reason I enjoy it so much is because I can completely relate to them. and I completely understand what they're going through. And I can be emotionally as well as physically involved in their recovery, in their preoperative evaluation, et cetera. A lot of the patients I see, don't even need surgery. And so as a result, I'm able to help those similar patients say, listen, this injury you have can be treated with non-operative treatments, and I can still get you back to the stuff that you want to do. And so it's extremely gratifying to me to have that sort of instantaneous results, but also to be able to completely relate to my patients, which makes my job way more fun and is the reason I love coming every day to the office.